a conversation about COVID-19 featuring Dr. Barry Collins. Knowledge is so very powerful that knowledge has the power to prevent a people from perishing. Hosea chapter 4, verse 6 says that my people are destroyed for a lack of knowledge. And so we're very, very excited, very thankful for all of you who have tuned in this afternoon. I see everybody, you're logging on, you're getting on. And we want to say thank you so very much for taking out the time of your schedule today to log on with Dr. Barry Collins and I. Now, we're going to get right on into it. We're going to have the opportunity for some questions and answers towards the end of our session today. But I also want to just kick off with some stats, let you know where we are and what's going on in our society, what's going on in the medical world, that I believe that a lot of individuals can get some information and some knowledge about this afternoon. Now, according to the latest data from the Johns Hopkins University, around 370,000 Americans are now infected with COVID-19, while under 11,000 have died. Several U.S. cities and states have now released statistics showing that the pandemic is providing particularly devastating for the African-American population. And these stats that we found are highly alarming for the African-American community. And I believe that it is my responsibility as a shepherd, as a faith figure, to make sure that our congregation, our communities are aware of what's going on with the COVID-19. Here are some stats that are very, very alarming. Number one, 57% of Black patients die from COVID-19. 57% of Black patients die from COVID-19. 37% of all patients are African American. And then more men are dying than women. And so I brought in Dr. Barry Collins, who is a physician in internal medicine. He works at the Pell City Internal and Family Medicine and is the chief of staff at the St. Vincent's Hospital, St. Clair. So I want everybody to join me in welcoming him today. We are honored to have you as our featured guest to give us insight, information about the COVID-19. We're going to cover several aspects about it. And just again, want to thank you, Dr. Collins, for taking the time out to share with the public and our congregation practical knowledge and insight that will make our future much, much brighter. So the very first thing that we want to talk about this afternoon is, what is COVID-19 really? What is that? What is this that we're dealing with?
Okay, thank you, Pastor, for having me here to talk about this subject. COVID-19 is a virus that's very similar to other viruses that cause colds, but this is a mutated virus. Says this is in the family of the coronavirus. Says in the past, coronaviruses have caused relatively mild upper respiratory symptoms, but this is a mutated version of that virus. Says COVID-19, and this causes a lot more serious complications than the previous coronaviruses that we've had in the past.
Gotcha. So basically, this has been around for a while, and it's basically mutated through the common cold, but we just got a brand new strand that's never existed before. Is that correct?
Well, it says coronaviruses have been around for quite a while, and if you go to a physician's office and they run a respiratory panel, says to find out exactly which virus that you have from your cold bug. It says there have been 4 very common ones that have been out there, but this is a mutated version. And very difficult to treat. This is because of the complications that it causes.
Gotcha. Okay. Now let's talk about this. We just talked about some very important stats. These stats that I shared with you earlier, highly alarming. One of those is 52% of Black patients are dying from the COVID-19. And 37% of these patients are Black. So what we're seeing is that the COVID-19 is having a huge impact on the African-American community. How is COVID-19 impacting African-Americans, and why is it impacting us in such a way as this?
Okay, the COVID virus is a very difficult virus to treat. And there's an old saying, when Black America, it says, when white America gets a cold, Black America dies from pneumonia. There's several factors that go into that. One is we're less likely to get treated. Two, we're less likely to get tested. And we have more serious complications. It says, and this is deep rooted from way back. Physicians, it says, with the African American community and physicians, there was a distrust going all the way back to the Tuskegee Institute study. It says, and how we were poorly treated back then. So now, the African Americans as a patient is less likely to come into the doctor, less likely to trust the doctor. And since we already have a high likelihood of having comorbid factors such as diabetes, hypertension, obesity, and respiratory disease, when we do get the virus, we have a higher fatality rate. The virus itself is colorblind. It doesn't matter if you're Black, white, rich, poor, whatever. It's the disparity in how people are treated, unfortunately. And this kind of highlights some of the dysfunction in healthcare as far as treating people of color in this country.
I see. So by African Americans, of course, we have a lot of underlining, a lot of African Americans have a lot of underlining issues and preconditions. And so individuals such as that they have diabetes or respiratory issues already right now, such as asthma, what are some practical ways of these individuals who may have cancer, or these individuals who may have diabetes or hypertension, all of these other elements that are already at work? What are some practical ways in order to preserve their health during this pandemic?
Our high-risk population right now for COVID are people that have respiratory disease, COPD, asthma, and the like, diabetes, any type of illness that would suppress your immune system. Say, for instance, you've had a transplant and we're suppressing your immune system so that you don't reject the organ. Or cancer. Or on long-term steroid use. Or connective tissue disorders, which we have to treat with steroids. The best thing that you can do, of course, is social distancing. Avoid anyone and just automatically assume that the people that you meet could potentially have the virus. So unless you have to go out, if you're in that high-risk population, don't. Hand washing is crucial because, again, it says you spread the virus through contact. This is a respiratory virus that's spread through droplets. Droplets, and so if you cough or sneeze, the virus can get spread, and that's the reason why it says we're asked to cover our mouths and wash our hands quite frequently.
Wow. Now, I want us to really hone in on something I think that's very important here. And one of the things I think that's very important is that we understand that this disease is basically spread by contacting individuals. So, Dr. Collins, will you really kind of explain to the public of how powerful the point is that sometimes people that have this do not show symptoms at first?
Yes. So generally speaking, it takes about 2 to 14 days after you've become exposed to the virus before you start exhibiting symptoms. And now there's so much about this virus that we don't know and is slowly coming around that we're learning a lot more about it. So now we're finding out before you even exhibit symptoms, anywhere from 2 to 5 days, you can actually be able to spread the virus and not feel sick at all. So in those cases, that's the reason why you should always assume that this says that the people that you meet, unless they've been in quarantine, that it says that they've been exposed or have the virus and could spread it to you. So it says hand washing, avoiding direct contact, avoiding touching your face, or your eyes. This is probably the worst time for this virus to hit, with all the pollens that are out there.
And allergies and sinus.
Yes, exactly. Because remember what I said before, it's spread through sneezing and coughing. And when you have allergies to pollen, what do? You sneeze, you cough. You have watery eyes. So what do you do when you have watery eyes? You want to wipe your eyes. And if you have any contact of the virus on your hands that's transferred from a surface, and you wipe your face and your eyes, then you just transferred the virus to yourself.
Wow. That's very interesting. So the truth of the matter is, we're coming back down to it, that social distancing is very practical and necessary right now.
Oh, absolutely. It says, it says, because again, someone coughs or sneezes and you're in a confined space within that 6 foot that says distance, and some will say even says further than that. It says then the virus can be spread to that individual. That's the reason why when it says on a bus or on a plane where air is being recirculated and you're in close proximity, the virus can be spread. It says quite rapidly. And unfortunately, says Pastor, says it's one of the things that we always tend to forget with this being a respiratory symptoms. It can also be spread by, it says just speech. Someone gets a little bit excited and speaks, and those P's get pronounced. And you get aerosolized saliva, and
Yep.
boom, it says somebody standing too close. There you go. You have transfer of the virus.
Just that fast.
Just that fast.
So let me ask you this. What can we as a community do to help preserve our health? Basically, such as millennials as myself, in my generation, I have a lot of individuals who do not have a lot of the pre-existing conditions, and I think some are taking it a little serious, and then there are some who are not taking it as serious as such. Like, I'm a healthy individual. I know a lot of my friends and a lot of my colleagues are in their 20s or in their 30s, and they're very healthy. And, they may wear the mask, they may put on gloves, but I know a lot of people right now that are just like, I can't get it. Can you talk to us from a medical perspective of those who meet that category and say, you know what, I'm pretty much a healthy individual. What is the likelihood that I could catch it, and how would my body respond to something like that if I'm already healthy?
Sure. Keep in mind, the virus doesn't know age, race, says money. It says none of that. So you can catch it just the same as someone older. So the fact that you have fewer comorbid factors means that if you catch it, then you may not exhibit some of the similar side effects or says complications that someone older that has those complications will. But it says, but you can easily spread it, and you too can die, although it's at a lower rate. It says younger patients, it says, have perished from this virus.
Wow.
For me, in working in the healthcare industry, what keeps me up at night is not me getting the virus. It says, although I'm quite a bit older than you, as you are, Pastor. It says it's not the fear of me catching the virus; it's the fear of me spreading the virus. Because God forbid someone comes in, I come in contact with somebody that's relatively healthy, that comes in that's healthy, and then I spread the virus to them, and they perish. When we go out in public now with the CDC asking people to wear the mask, it's not to protect those people wearing the mask. It's to protect the people that don't wear the mask. Because again, the mask that says that the CDC is recommending that we wear in public. Those aren't the N95 masks that says that healthcare workers wear to prevent us from getting the virus. But it does cut down on the transmission.
That's good. That's very good. I've also read some information. It's a whole lot of information out there right now about what to do, what not to do, how you can catch the virus, how you can't catch the virus. Can you talk to me about the importance from the medical perspective of even catching the virus from like surfaces?
Yes, there's a lot of disinformation out there that's out there now, and a lot of panic. Says the virus is a respiratory-borne virus. And the virus can stay on certain surfaces for quite a while. So if you breathe on or cough on a surface, the virus can live there, says, for a number of days. So that's the reason why it's important that if you come in contact with a surface that you're not familiar with, to wash your hands and try to disinfect that surface as best you can. Says, but one thing which I do not want to see people doing is panicking to the point where they impose on other people's health and freedom. It says there was an issue with someone in our office that went to Home Depot. The person that was in line was so afraid of catching the virus that they were spraying everything down on the cart, which was fine, which was the appropriate thing to do. But then they proceeded to spray the person that was checking them out with an unknown disinfectant, which is not okay to do. Says
Right.
you don't know what that person is allergic to. That person doesn't know what you're spraying. So now you've endangered that person's life. It says for a fear that it says of a virus that if you're that afraid, you shouldn't even be in Home Depot in the first place.
Exactly. Exactly. Wow, that is powerful, powerful, great information. Let me ask you this, Dr. Collins, what medical insight can you share that the media is not focusing on right now?
Okay. Everybody's always talking about, says when they go out, says we want to wear the mask, we want to wear the gloves. Of course, we talked before about the mask. The mask isn't to protect you, it's to protect the people around you so that they don't get the virus. It says gloves. When you go in, it says gloves are meant to be single use, meaning that when you come in contact with, it says with something, if you go into a store and you put on a pair of gloves, when you leave the store, you need to, it says, get rid of those gloves
Mhm.
because again, the virus is on the surface of the glove. You
Right,
touch everything in the store.
right.
Says now the virus is on your, it says on your hands. You don't discard those gloves. You wear those gloves when you get in the car and you grab your steering wheel. Guess what? The virus is now on your steering wheel. You
Wow.
don't change those gloves and you go to another store. Now you've transferred the virus from store A to store B. So if
Mm.
you take the gloves off and you put your hands back on the steering wheel, well, guess what? Now you've got the virus on your hands. That says, and everything that you've done as far as wearing the gloves, it says, has been undone.
Wow. Well, so and then there's also a shortage of gloves going around. So using hand sanitizer is very, very important. And just
Yes.
keeping your hands clean, I think that's very important. Making sure that your home is sterilized, making sure that everything that you're keeping is sterilized, that you're touching, that we're just making sure that our surfaces are very, very clean in this season. Because as you said, you can pick it up by surface. You can pick it up with droplets of people talking very closely with you. So thank you for sharing that information. We do have some questions that are coming in that I believe that you are definitely qualified to answer. One of those questions is, are there vitamins that we can take to build up our immune system?
Okay. Now it says if you're eating a good healthy diet, your immune system should be strong enough to says to fight it out to fight it off without serious complications. Remember, the death rate is only says only 3%, but 15% of patients that contract the virus end up requiring hospitalization. That means the odds are in your favor. You have an 85% chance that if you catch the virus, you're going to recover without any problems, without any hospitalizations, and everything should be fine. But making sure that you stay as healthy as you can is going to be crucial in order to fight off this virus. Antioxidants, making sure that you get enough vitamin C and zinc, making sure that you're well hydrated during the infection. Those are going to be crucial. Making sure that your blood pressure, more importantly, your blood sugars are controlled, because even when your blood sugars are high, it says the white blood cells that fight off the infections are ineffective, meaning that they're weakened. So that means your body can't fight off infections as well, and therefore you're going to get more complications. So controlling your blood pressure, controlling your blood sugar, those are going to be crucial. So during this time, during these times, it says, and the sad part about it is right now we have a lot of people that says that are scared to go to the doctor because that says they're afraid of getting the virus, and understandably so. We've
Mm.
taken precautions to try to separate the patients that could potentially be infected from those that are healthy and have other medical problems. But they're not getting their blood pressure and diabetes treated, so therefore they're increasing their risk. And people are still having problems with heart attacks, strokes, and other accidents and health issues that aren't being tended to during this time because of panic.
So let's repeat that one more time. So making sure that your blood sugar and you said your blood pressure is very critical right now.
Yes, because again, it says when you become ill, a lot of times it says you get a spike of your blood pressure, and if your blood pressure is already it says high to begin with, this increases your risk of strokes and heart attacks.
Mm.
Um, and of course, with your diabetes, says if you can't fight off the infection, then you're more likely to have the complications and secondary infections due to the virus.
Wow. And then you also said that vitamin D is very good for right now, as well as vitamin C.
Vitamin C and zinc. That says
Vitamin C and zinc. All right.
yes,
Got
it says antioxidants. Those are says your body's says key elements that they need to fight off any infection.
Okay.
So again, it says, although we don't have any proven studies, says showing that these vitamins says are of great benefit, it says anecdotally, it says we use those whenever we get a cold or any other illness, and people tend to bounce back faster. So therefore, if we're looking for it says a way that you can keep your body in as good a shape as it can, vitamin C and zinc are two of the things that we recommend. Now, keep in mind, everything in moderation. You can't overdo it. The body will only take what it needs, and then the rest of it gets excreted out in urine. So, so overdosing on vitamin C and zinc is not the answer. Just taking what the recommended daily allowance is.
That's very good. That's very good. So everybody listen up. We have over 150 people that are tuned in right now listening to this conversation. And I just want to remind everybody to make sure that you're taking vitamin C and zinc, okay?
Yes.
We do have some questions that are coming in. I do want to encourage everyone, if you have questions, go ahead and place those in the comments. We're going to get to those in just a moment. Let's see. Here's another question. What type of foods should we eat to boost our immune system?
Yes, says types of foods that I would recommend says are vegetables and fruits. Those are a good way of getting vitamin C and zinc and some of the other antioxidants. So a good, well balanced diet with fruits and vegetables. That's the reason why we always recommend an apple a day keeps the doctor away.
Yes.
Orange juice and things of this nature.
Yes.
Now keep in mind, if you have kidney problems or renal function renal problems, it's probably not a good idea to drink a lot of orange juice, because if you have kidney failure, then your potassium can build up, and that's not what we want to see in those people that have severe renal disease. So be mindful of what your underlying medical conditions, and just don't overdo that as well.
Okay. Let me ask you this. Also, do you recommend taking Airborne daily?
Airborne daily, it says has no proven benefit, but it definitely does not cause any harm. So taking that, it says if you're concerned, won't hurt you. I can't promise it's going to do a whole lot of good. But I can tell you that it says that if you're desperate and you're looking for any little edge, then it's okay to take the Airborne daily.
Okay, very good. And from a medical perspective, how long do you think this pandemic is supposed to last?
That's going to be very difficult to say, because this virus is an RNA virus and it mutates quite rapidly. It's what we call slippery. Already, it's gone through 2 different mutations in order to get where we are now. It says it is possible that we will be able to develop a vaccine, but if it mutates again, then there's no promise that the vaccine that we develop will be helpful in fighting off this virus. Now, the only way to really stop the virus is to starve it for air, which means don't give it another host for it to spread to. Says, case in point, if I get the virus, my hope is that I'll be the last person to get the virus and I wouldn't spread it to anyone else. It says it's like a forest fire. It says if you starve it for fuel, starve it for oxygen, then it dies off. But this has a potential of lasting quite a while if we don't take the necessary steps that we need to. Now, good point about Alabama and where we are right now. In Alabama, we don't have the spikes or the outbreaks that larger cities and states do, such as New York, or LA, or Seattle. Which says, in part, it's due to our lack of public transportation and being less crowded. So we can social distance a lot better. But make no mistake, if we don't continue doing what we need to do, it can spread.
Let me ask you this, Dr. Collins. Can you get the virus more than once?
Right now, it says it's unclear.
Okay.
If it behaves as other viruses do, then the answer is no. Because once you get the virus, you develop antibodies that should be able to fight off the virus. Okay. But as I said before, the virus is slippery. It can mutate. The same way that we didn't think that if you had the flu, the swine flu, and it's influenza A, that you could get that strain again. Well, that virus is mutated. So yes, you can have that same virus again a second time because of the mutation. Right now, the hope is that if you've had the virus, you're less likely to get it again, but there's no guarantees.
Got it. Got it. And then also, here's another question that I think that's really, really practical and really strong that I've heard a lot of people mention. Is it possible that some may have had this virus back in December or during the early time of the fall when everybody was getting sick and a lot of people were going to the doctors and the doctor was like, I don't know what it is. I know even some of our members here at the church, they got sick around about November, December. They went to the doctor. They said, you don't have the flu, you don't have pneumonia. We don't know what this is, but we know you got a virus. Do you think that it was the coronavirus or COVID-19 even back then?
It is possible that it could have been around back then because, again, it says there are several different versions of the coronavirus. It says at least 4 different versions that we test for, it says, in our respiratory panel. So you can get very similar symptoms to what we have now. It says, but this version, again, is a mutant of those previous versions. There are hundreds of thousands of different viruses that are out there that can give us similar complications, but this one seems to affect our respiratory system and is very virulent as far as how it spreads. The only way to know that is through testing. The test for this coronavirus that says COVID-19 has just been released. It says we're going through the process of getting it, says FDA approved, and then you can tell whether or not you have says an actual active infection or an infection in the past. How we do that is by knowing which antibodies are present in the body. If it's an IgG, then that means it says that you've had it in the past. IgM means you have an active infection.
Gotcha. Okay, and then let's see. Legarius Collins says that we have heard a lot about the malaria drug in the media. Does taking this drug work, and what are the risks? Now he put a drug on here that I cannot pronounce, but it is
that's hydrochloroquine. It says and quinine. It says quinine. Yes, it says Plaquenil for people that are taking that have lupus. It says and are taking similar drugs. These drugs have been out for quite a while, and we're hopeful that it works. Unfortunately, there's no way that we can guarantee that this will work for each individual. The study, which everybody's touting, that initially came out, only had 20 people in the study. So I can't draw a conclusion off of a study that only had 20 people. Plus, we don't know whether or not we should give the drug early, says late, says the appropriate dosing, how long the medicine needs to be given. So there's a lot of unanswered questions. And really, when we're talking about saying that it's a safe drug and everybody should be taking it, that's not entirely true. In rare circumstances, the drug itself can cause problems with cardiotoxicity, meaning that it could lead to heart damage. It says although that's extremely rare, it is out there. And the studies that we're talking about, we're combining that drug with zithromycin, another drug used in combination to treat the COVID-19 virus, and that drug can cause some arrhythmias with the heart. So even though it's listed as being safe, that's safe with a caveat. It depends on the individual and their underlying heart conditions as far as whether or not you can say it's safe. Plus, in certain cases, the drug can actually cause blindness.
Wow. Now, this is also a very good question. We're going to probably ask maybe about 2 more questions, and then we're going to wrap it up. And we may have to come back, Dr. Collins, because this is a hot one today. Rachel has a question. She says, does the virus stay in your throat for a number of days? And can hot beverages push it into the stomach?
Says no. Unfortunately, hot beverages can't push it into the stomach. It says we're doing a lot of research. We know that generally if you quarantine yourself for 14 days, and you're asymptomatic, then generally speaking, the virus says your body has enough time to clear the virus. Again, you're talking about 2 to 14 days from exposure, and then another 14 days after you develop symptoms before the virus is cleared, and you can be deemed as quote unquote safe. It just says, but the only way to know for sure would be to test the person a second time. And right now, testing availability is hard to come by. It says we have a couple of reasons why. Now there are a bunch of tests that are out there. There's a shortage in says the testing supplies as well as the testing agents that we use in order to get the results back. So although you may be tested today, it may take you 7 days before you get the results. So that's the reason why people need to stay isolated. And when you get the test results, you're going to have to wait another 14 days before you're cleared to go in. It says go out into the public.
Absolutely. Dr. Collins, here's another very powerful question. And this individual is saying how, and this goes along to knowing also about when to go get tested.
Yes.
Should I go and get tested if I have these certain symptoms? And so here's the big question. How do I differentiate between if I have COVID-19 symptoms and if I just have sinus or allergies?
Okay. Now, it says the hallmark symptoms of COVID-19 are fever, says cough, and shortness of breath. Now, again, it says we're talking about a fever over 101. Those are the hallmarks. Says not everybody gets these symptoms, but a majority of people that have those symptoms says are under the suspicion of having COVID-19. If you've traveled outside of the state, this says, or now I would say just anywhere, it says we used to say that the hot button areas as far as Korea, Italy, Iran, Japan, and China. Now it's not the case because the virus has spread so far. It says, but if you have any of those three symptoms, it says plus a known contact. When I say a known contact, everyone always says, "Well, I want to be tested." Well, tell me exactly who were you exposed to. It says, give me the name of the person. It says, and exactly where it says, where did you come in contact with them? You have to be very specific. Someone that's been tested positive that we can verify, and it says, and you've been exposed to them within the last 2 to 3 weeks.
Got it. I also have a member that is currently in quarantine right now, and she would like to know how long, while a person that's in quarantine, does it take the pneumonia to clear from the lungs?
Now you're talking about two separate problems. You had your COVID-19, so you have COVID-19. That virus in and of itself is a problem, but your immune system is weak, and the bacteria that normally floats in the air and on the surfaces that we just normally are able to keep at bay have been able to get a foothold in your body and cause other problems. So it takes about 14 days for the body, for a strong body to clear the COVID-19 virus. But if you have pneumonia, now you've developed a secondary bacterial infection, which is going to need antibiotics. And and for that, it has its own timetable. Wow. Usually we say if you have a simple pneumonia that's not complicated, another 7 to 14 days.
Okay. That makes perfect sense. Makes perfect sense because, like you said, there are two different situations. If you got COVID-19 and if you got pneumonia, those are two different illnesses.
And you combine those two illnesses in a weakened body. So now we're having a more serious problem because with COVID-19 you're already having inflammation in the airways that are closing things off, and you combine that with swelling caused by the bacteria. It says this is just a recipe for disaster.
Another good question that I believe that we have here, can you take antibiotics to help build your immune system and to fight?
Keep in mind, this is a virus, so antibiotics in and of themselves don't do anything to the virus. They prevent a secondary infection. That means if you if you have those bacteria in your system, and your system is weakened enough that bacteria is able to take hold, then the antibiotics can actually prevent that secondary pneumonia from occurring. So taking antibiotics prophylactically does not do anything for the COVID patient.
Okay, that makes sense. So for those individuals that have been tuned in this afternoon, listen, if you have any type symptoms such as fever over 101 or at least of 101, shortness of breath, anything of that nature, you need to make sure you go and be tested as soon as possible. And please, please, please make sure you are keeping your hands washed. please make sure that you are practicing good social distancing because, again, this virus can be spread even in the air, through surfaces, through respiratory droplets. So let's make sure that we are taking care of one another. Yes, faith without work is dead. And we believe that God is a healer. We believe that God can heal all manner of disease. But people, we have to do our responsibility and our part, and God will do the rest, and God will cover all of us, and we'll come out of this season and this situation, this pandemic, 10 times better. And so, Dr. Collins, is there anything else that you would like to share with us this afternoon?
Says a lot of times with says if even if you do have the infection, you're going to survive the infection. But there are some hallmarks to look for. It says as far as when when you should break and seek medical attention. If you're starting to develop chest pain, it says with the virus. If you're having difficulty breathing, it says and you have discoloration. If your fever isn't breaking with with our usual Tylenol. Then you want to contact your your physician and see if you're starting to develop any of the secondary pneumonias and secondary infections. And and at that point we can treat you. Don't be afraid to come see a doctor, but just make sure that that you make us aware of the symptoms that you have before entering the building, because again, we would like to try to keep you separate from from patients that are coming in for their well visits.
Please say that one more time. Don't be afraid to see a doctor during this pandemic. Please.
Yes, yeah, exactly. It says we're
Please.
here. It says we are not overloaded. It says in the primary care office. Yes, this says the hospitals are overloaded. If you go to a hospital, then expect a long wait there. For most of these symptoms, it can be handled at the primary care level. So call your doctor, and then give the primary care doctors an opportunity to head this off, so that we're not overloading the hospitals and the emergency rooms.
Let me ask you this very quickly, because I think this is very practical that someone may ask as well. Let's say, for example, they're experiencing some of these symptoms and they're like, I don't want to go to the ER. Should they go to a COVID-19 testing site first, or just go straight to the primary doctor?
If they have a primary care doctor, their first stop should be the primary care doctor.
Let's repeat that one more time, because I don't think the public knows that.
Yes.
Because the media is pushing so heavily, go to a testing site, go to a testing site, go to a testing site. And this is my very first time hearing a physician say, come to the primary office first, not to the COVID. If you have a primary doctor, this is my first time hearing that. And I think that is superb, ice-breaking information for the public.
Yeah, we're supposed to be your first stop. It says if you have any problems or any questions about your health, give us a call. It says if they don't have testing set up in your primary care office, then they can direct you to a testing site where you can get the test. That says in a very timely manner. It says, I hate to say it, but with any illness or any outbreak, there's always going to be schemes and scams in order to separate you from your money. Mm-hmm. So don't get pulled into this. Even if you don't get tested, it says if you quarantine yourself for 14 days, it says you're fine. It says if you don't experience any of the complications after 14 days, then the symptoms, then the virus has passed.
Very good, very good. Thank you so very much. I think that's powerful information, great information for us all. Last comment and last question from Joan Bishop. She says, my husband was in the hospital in February with the flu and pneumonia and readmitted in March for pneumonia again. Should he be tested?
Says, I'll be honest with you, if he came in with flu and pneumonia, it says now in the hospital, it says if you have any underlying problems, his immune system was already weak. So if he came in contact with someone that had the virus, then it's easily transmitted to him. And and just by virtue of being in the hospital, this says it could be spread. So the hospital is a great place to be if you're sick. But you can also contract other illnesses from other people. So yes, that person should be tested. This is for the COVID virus.
Got it. Okay. Dr. Collins, thank you so very much. This is Dr. Barry Collins. He is the Chief of Staff at the St. Vincent's Hospital, St. Clair. Also works at Pell City Internal Family and Medicine. It has been an absolute honor and a privilege. For those of you that are just tuned in, please make sure you do us two favors. Press the share button because If you share this information, it's going to make our world a much better place because knowledge is powerful. As I said in the very beginning of our webinar this afternoon, that knowledge is so very powerful that it can prevent a people from perishing. And so, again, I want to thank all of our listeners that have tuned in from near and far. Thank you so very much for your time this afternoon, Dr. Collins. And maybe we'll come back on here and do this again with some more information for our public.
Absolutely, sis.
And everybody's safe. I think this has been absolutely phenomenal.
Absolutely, sis. Just say the word and I'm here.
Yes, sir. Thank you so very much. All right, everybody. Thank you for tuning in. I'm Pastor Shaemun, pastor of the Tower Prayer Church of Leeds, Alabama, the place where God is transforming lives. We are praying for all of you out there. Please stay safe. Keep your hands washed. Practice social distancing. And stay prayed up because we are still covered according to Psalms 91. Again, thank you so very much for your time, everyone. And we look forward to seeing you again soon. God bless.